Hi, good afternoon. We're here on the acute unit at Denver Health Medical Center right now, and I'm Philip Mehler. I'm the founder of this unit and the executive medical director. And we wanted to provide this service to those that suffer with eating disorders and professionals in this field to give them an update about what ACUTE is doing during this unprecedented time in medicine due to the COVID pan-epidemic. I'm standing here with Dr. David Wyles, who is the Chief of Infectious Disease at Denver Health Medical Center and a professor of medicine at the University of Colorado School of Medicine. And wanted to ask Dr. Wyles just a couple questions about ACUTE and the safety of the unit and the reason that people should not delay treatment if they truly need ACUTE's well-heralded services. Dr. Wyles, I know you've been a consultant on this unit for us occasionally, seeing our patients who have infectious disease issues. Do you mind commenting on just your overall impression of the unique safety of this unit, knowing that no place is totally safe, but that this is different than a typical medical surgical hospital?
Sure, yeah, and thanks Dr. Mehler. So at Denver Health with the acute unit right here, our infectious disease consultant team pretty routinely sees patients over here. I would say at any given time, we're usually following 1 or 2 patients on your unit. And certainly over time, we've learned how both medically and psychosocially complex these patients are. And I think we've learned to really look carefully at what's going on from an infectious disease standpoint, knowing sometimes presentations of infectious diseases may be a little different for this patient population, and certainly knowing they don't have as much physical reserve maybe as some of our other patients. So we certainly spend a lot of time being very sure we're comfortable with our diagnoses and treatment plans. In terms of kind of this unit and a general risk with all that's going on, you've already alluded to the COVID pandemic. There are some unique things about the acute unit. One, it's physically separated from the rest of the hospital, which I think is probably something that's beneficial in this time. At Denver Health in general, so folks are aware, we have instituted policies where we do have screening at the doors. We don't allow visitors actually right now, except under special circumstances, to kind of minimize the potential for somebody coming from the community not realizing they may have this infection and spreading it. And then one thing we've instituted again across all of Denver Health is that all of our patient-facing practitioners, nurses, doctors, other support services are all wearing surgical face masks when they're interacting with patients. And that really is a measure to protect patients from somebody that may be asymptomatic, but could potentially still spread this. And so that's a protective measure for our patients as opposed to protecting the individual wearing the mask. So we have all those things in place. And again, I think the physical separation of the acute unit does provide some extra layer of protection.
Thank you. Any thoughts, Dr. Wyles, about our patients vis-a-vis perhaps increased risk of contracting that infection? I'm pretty aware that there's not much written about the pathophysiology of infections in people with extreme forms of eating disorders, but any thoughts on that, just given the overall malnutrition that these patients suffer from?
Sure. Probably the biggest thing is, this is a very new disease, really. It's something we've known about for a few months, but really don't have a lot of data on. We could take some analogies to other viral infections. But as you alluded to, and in fact have written about, we still are really learning a lot about what the immune system looks like in patients with severe eating disorders or weight loss. It's probably a dysregulated immune system. They're not necessarily just immunodeficient. Their immune systems may just respond a little differently. In terms of specifically how they would handle a COVID infection, I think there is reason to be concerned that they might be more prone to severe disease, but we certainly don't know that that's a fact. And again, at least my personal view is coming back to maybe not so much that their COVID infection would necessarily be more severe, so we might rely on the other indicators underlying cardiovascular disease, diabetes, advanced age, all the things that we have come to appreciate as risk factors for severe COVID infection. But then coming back to the concept that really for patients with severe eating disorders, that they just don't have a lot of reserve. So they don't have a lot of ability to withstand additional insults if they occur. But again, we're going to be learning over the next probably several months, unfortunately, as we deal with this, about the best ways to address this in all different kinds of patient populations.
And given that You were just consulting on a patient for us over the last few days and have spent a fair bit of time up here on the acute unit the last few weeks. Let's say a patient and a family are sort of vacillating about, do they address this extreme eating disorder right now, or do they put it perhaps in abeyance for a few months down the road? Given everything that's going on and given that none of us can be that prophetic to really know what the best thing to do is, what would be your qualified message to families and patients that are struggling with this decision right now?
Yeah. I think, we all need to be cautious in this time, but we still need to not lose sight of underlying medical diseases and processes. And I do worry that in all sorts of diseases, not just eating disorders, but surgical treatments, cancers, other things, that we may be putting things on the back burner a little too easily. So specifically for patients with eating disorder, especially when they have really low ideal body weights, very, very low body weights that we know is really a serious medical condition, I think obviously they need to get the medical treatment, and the risk benefit would be in favor of treating them in these specialized units that you're so adept at doing, because we know this is really a serious medical condition, a highly morbid condition. And I think putting it off for months, the risk to the patients is probably higher than the concerns about acquiring COVID in a hospitalized setting, with all the other caveats we talked about, that there's a lot of protections in place, although nothing is perfect.
And then lastly, we in addition, on acute, in addition to physicians and nurses being masked when they are in contact with patients, all of our dietitians who are so integral to our program here, our social workers, our psychologists, our psychiatrists, the nursing assistants who spend a lot of time in the room protecting the patients from falls or purging behaviors. Everybody wears a mask here. We've stopped meeting in our conference room for our weekly rounds, and we do that now by teleconference from different phones on the unit. We also, as you mentioned, have a separate entrance into the building, which is 1,000 feet away from the main hospital building. We also have this unit locked, so you can't just walk in up here without us seeing who's at the door. Any other things from your vast experience and as Chief of Infectious Disease for Denver Health that you might suggest that we might do in addition to that? Obviously, we're doing hand washing. Obviously, we're doing social distancing, which are really rudimentary and critical to stop the spread of this disease. Yeah,
those are the key points, I think, certainly. The other thing I think it's always worth reminding folks, and what we're doing, again, with our Denver Health staff at large, is making sure people are kind of monitoring for symptoms. And I think there's sometimes some concern. People are a little worried or feel they'll be discriminated against maybe a little bit if they report symptoms or have to tell their supervisor they need to stay home from work but if they have symptoms. But that would be the other thing. Please, if you have symptoms and you're concerned, don't come into work. Let your supervisors know. And then at Denver Health, anyway, for Denver Health employees, we have an online survey they can go online, fill out. It will kind of assess their symptoms. And we have employee testing then, if they qualify based on their survey, that we can schedule them a time to come up and be tested so they're not waiting in a queue. They actually have an assigned time to come get tested. So all the other measures we mentioned, but please monitor your symptoms and don't come in if you're sick.
And because ACUTE is part of Denver Health Medical Center, which is one of the premier safety net hospitals in the United States, we have a daily briefing that's sent out, sometimes 2 or 3 pages with updates about the disease. And in all of those, there's a daily loud admonition to please report symptoms to your supervisor immediately if they occur, and what to do, as Dr. Wyles said. We really appreciate your consultation up here over the years and taking care of our patients. We appreciate you getting together with us today to further corroborate the fact that ACUTE is open for business. We're here to serve and really be the beacon of hope for those with extreme forms of eating disorders up here, as we've done for many, many years. And we want you to come if you need help and not to hesitate just because of this unfortunate situation that's going on in America, which we all hope and pray will end very soon. Thank you very much, Dr. Wyles.
Thanks.